April is Autism Awareness Month, and just last week, Hollywood shined a light on the topic when actor Robert De Niro not only pulled an anti-vaccine film from his Tribeca Film Festival lineup for April, but he then revealed that his son is also autistic. And this morning, we have Dr. Eileen Shi from Healthcare Partners joining us to discuss a little bit more about Autism Awareness Month and also the controversy with the vaccine. I know so many people are passionate about it. Do we need to be worried? Is there a clear answer?
There's not a clear answer. There's been a lot of speculations, a lot of studies trying to draw a causality, but we don't have any scientific studies that really say that vaccines will definitely cause autism. I think it goes to the fact that autism is a multifactorial, genetically based, but also with environmental based disorder that comes to the neurodevelopment, the social development of your child. And since we don't have an answer of what causes it, and you notice these developmental changes at a young age when vaccines are given, there's that timing correlation, so that leaves a lot of, for questioning.
Okay, so 1 in 68 children are affected by autism, and I was reading that it is treatable, but early detection is key, like you were saying.
Yes.
So, I mean, how do we know? Is constant doctor visits? Is it things that we look out for?
You look for signs. Well, every pediatrician by the Academy of Pediatrics should be screening for autism between ages 18 months and 24 months. And as a parent, if you're noticing a child is not kind of different from other children, not making the same kind of eye contact, social connectivity, where in a group setting, your child is kind of in his or her own world as opposed to playing with other children, that's a sign, some of the red flags you can start picking up. And I would encourage anybody, if they have a question about that, to try to talk to your pediatrician, bring it up as a conversation, and to start the evaluation process.
Now, how do you decide? What do you recommend? Is it difficult, or do you just give patients options? Here are your options. You can get the vaccine. You can, what do you recommend? For
the vaccines, I always recommend it because as a pediatrician for the Academy of Pediatrics, we are supporters of vaccines because it's for preventable illnesses. But it is something that we increasingly are having conversations in the office to answer and address some of the concerns, because this is a big deal and it's important for the parents to understand and for the whole family to be on the same page. So it's an open conversation, and we often just talk about it, and until both parents and the whole providers, everyone are comfortable with the scheduling.
Yeah, it is tough, because I know so many parents are like, well, I've got to get my kid these vaccines because there's all these other things that they could get and prevent, and so it's a tough decision. And I know that a lot of celebrities have brought the issue to light too, which has caused obviously it to be a hot topic, bringing it to light, right?
Absolutely. I think we just want to do the best for our children and make sure that it's a safe process. But as in anything for vaccinations, it should be an open conversation to have.
Okay. For more information, where do we go? Anywhere?
You could go to American Academy of Pediatrics, or you can go to healthychildren.org. There's a lot of information out there for parents to look for signs of autism.
Okay, perfect. Thank you so much, Doctor, for joining us.
Thank you for having me.
Todd?
All right, Dana, thank you. First Lady